Okay, it is 3 o'clock, so we are going to get today's webinar started. Welcome. My name is Marie Eagle. I'm with the AAoM Michigan, and on behalf of the Michigan Department of Health and Human Services and the AAoM, we would like to welcome you to this month's webinar. Today we have with us Karah Ley, Education and Outreach Coordinator with the Autism Alliance of Michigan. She is going to be talking about the My Navigator program. We are going to hold questions until the end, but please feel free to submit them in the Q&A, and we will have time at the end of the presentation to ask and answer some questions. So without further ado, I'm going to turn it over to Karah.
Thanks, Marie. Let me get my slides shared up here. And as I'm doing this, if all of you who are signed on, please, if you would be willing to, in the Q&A portion, I know this is a webinar feature, if you would be able to share your profession, or if you're a family or individual receiving services, that just helps me know my audience. Let's see, I see someone in the chat says, actually, so you can put it in the chat. And also maybe your region too, just because knowing where people are signed on, that will help me in my presentation today, please. I will get this pulled up. Okay, so hoping everyone can see this. As Marie mentioned, I am the Education and Outreach Coordinator here at the Autism Alliance of Michigan. I'm excited to be with you all today and discuss what is an AAoM Navigator and how can they help me. I also want to share too that I have an older brother on the autism spectrum. So not only is this my profession, but this is something very personal to me as well. And going into this, we do have our CEO, Colleen Allen, with us today, who is going to be sharing briefly about our mission and vision at the Autism Alliance.
Thank you, Karah. Well, we appreciate all of you having us today, and Karah is our absolute fabulous, was a navigator, so certainly knows this very well, and now is obviously helping us with some outreach and community presentations, and she's the best person to be sharing some of it with you. But I wanted to just provide a little bit of background information about who we are for those of you that don't know us, more broadly around our strategic pillars and the work we do. We are a statewide organization. We are a professionally led organization. While we love our volunteers, our staff are trained autism specialists in a variety of fields, and specifically to the Navigator program, really have expertise across many disciplines so that we can address the issues that surface for families throughout the lifespan. We are guided by the vision: people with autism will lead lives that meet their greatest potential. And of course, the mission is to lead efforts to raise expectations and expand opportunities for people touched by autism. So with that, I will share a little bit about our next 3, 5, 10 years, which are really, we're laying that out now in some new strategic planning. Our goal, of course, when you think about what an individual needs in the life cycle, starting with the earliest age of diagnosis possible in order to secure interventions, which we know can be life-changing from the earliest ages. So our focus, of course, is on identification efforts in the earliest ages, and then through navigation, connecting families into what they need. And of course, navigation doesn't end at that point. As you think about the next phase of the life cycle, we are focused very deeply, especially over the past couple of years, on special education reform and broad community education around awareness and acceptance and inclusion. So navigation, first pillar, and early identification and access. Second being education, putting an individual on the path to education, quality, equitably funded education. And then we look at it as laying the foundation for independent living. and employment. And so that's very broadly, it is a lot, most days a little overwhelmed by the work we do, but much of that work is very much generated out of what we see and hear from our families through our Navigator program. So with that, Karah, I will hand it back over to you.
Great, thank you so much. So that was, yep, just capturing our mission and vision at the Autism Alliance. And we will segue into our agenda today. So we are going to discuss, as Colleen mentioned, our 3 pillars. We'll move into that, and then the My Navigator program, or you will also hear me reference it as just Navigator. That is a primary portion of today's session. I will speak on how to refer families to us through our clinical portal. I have 2 case studies I will be discussing with you all today. And then we will touch on our other programs and what fall under the other pillars. And then we will end with about 10 to 15 minutes of Q&A. So if you have questions, please feel free to submit those, and then we will address them towards the end. So looking at our pillars of work, as Colleen mentioned, it does start typically with navigation. So it's a lifelong guide with professional help and answers for anyone touched by autism. So ideally, we would love to support a family or an individual as early in this process as possible. And I will get into that a little bit more later as why that is so critical. And then education, this pillar drives initiatives that address root causes of systematic barriers to access, opportunity, and outcomes in education, while supporting increasing acceptance that leads towards preparation of a safe and healthy life. So this may sound like a very ambitious goal, and honestly it is, but we are very driven by it at the Autism Alliance to make an impact in systems change in the special education realm. So this is something that we are really geared up for at the Autism Alliance. And so this pillar, you know, if you look at starting with navigation, then obviously as children age, they go through the education system. So then thinking towards next, our 3rd pillar is our employment, and thinking of other types of supports that individuals need as adults. So this is following the lifespan now, you know, as an adult. With our 3rd pillar, we have a LLC staffing agency called Upbound at Work, and we will discuss that too later on. But it is to maximize employment opportunities for individuals of all abilities across industries through innovation and partnerships. So not only are we supporting job seekers and candidates in getting gainful employment, we also are training and educating employers on the many benefits of hiring someone who is neurodiverse, and really there are many. So those are our 3 pillars of work that we work under in our different departments. And we will move now on to the Navigator section. So Navigator, it's a free consultation program provided by our experienced autism professionals. We have a variety of professions working in our Navigator department, from social work, occupational therapy, we have BCBAs, retired special education teachers, and they bring a lot of background and decades of work behind them, and really being an experienced autism professional. And so they work Monday through Friday answering phone calls or emails from 8 a.m. to 6 p.m. related to any questions around accessing autism services or how to obtain some information on how to navigate this journey. So they really do help identify the appropriate resources that the caller is looking for. And what they do, they always, on the first phone screen, obtain some information to document, and really the 3 critical bits of information that they always really need to be the best or the most supportive is the individual's age, their insurance coverage, and the location or region that they're calling from. And this really can help us tailor our resources, because we do have a pretty large database across the whole state of Michigan of resources to really hone in and provide some specific options relevant to this family or caller. So we do serve the whole state of Michigan, from the southern border all the way up to the Upper Peninsula. So, you know, families who are calling us live in, you know, either rural, urban, suburban areas, and we are continuously growing our database and resources to be able to support all families across the state and what they are seeking. We do have a fun video. Let me make sure that my sound has shared. I am so sorry. I'm always speed right into sharing screen, and then I'm worried that my sound is shared. Hopefully this can. This is a day in the life of a navigator.
Hello, everyone. My name is Kim.
And my name is Brittany.
And we're here to talk about the Navigator program. I mean, what exactly do we do?
That's a good question.
Here at the Autism Alliance, the mission is to lead efforts to raise expectations and expand opportunities for people touched by autism across the lifespan.
As you know, Autism Alliance was founded in 2010, which eventually led to new insurance legislation. A few years after that, the Navigator program was launched.
Currently, the Navigator program has served over 8,000 families and counting. Not only do we help individuals and families, but we also provide support to clinicians and providers as well.
We serve the entire state of Michigan, from Metro Detroit to the Upper Peninsula, and we work to find resources related to everything from therapy to support animals.
So, Brittany, spill the tea. What exactly does a navigator do?
Well, Kim, as a navigator, no 2 days ever really look the same. But let's take a deeper dive into what an average day could look like for one of us.
So let's start with Mr. Smith. He needs an evaluation for his son. Well, seems pretty simple, but that's not always the case. Things can get pretty complex.
After you get off the phone with Mr. Smith, you find evaluation sites that accept his insurance and are close by. Sounds like an open shut case.
Yeah, not really. Well, now Mr. Smith's son is diagnosed with ASD. And although this may be a very overwhelming process, this is where the true navigation support comes in handy.
With a new eval, it takes a bit of time to find all the appropriate resources, but I think I've got this.
All right, clinical resources sent. Mr. Smith should be all set. Oh, wait, he's asking about school. Time to call our education specialist, Heather. Right, looks like we should be good to go. ABA therapy said school is good. Uh-oh, looks like she's having an insurance problem. Time to call our insurance specialist, Shanta.
So that's what navigation looks like. One thing starts here, another starts there, ultimately providing information to help empower the families and point them in the right direction. All of our knowledgeable and experienced navigators can provide so much support for families and clinicians who are in need of our assistance. Keep in mind that navigators also have specialists that we collaborate with quite often. This includes insurance specialists, education, community adult resource, and our clinical specialists. And their knowledge and support is greatly appreciated when we are helping our families navigate through different barriers and situations.
Families and professionals can reach the navigators through email, phone, or different portals. Spread the word so we can encourage our community to find help, hope, and answers today.
También tenemos los navegadores que hablan español. Ayudar, esperanza, respuestas hoy. Gracias por ver. Hasta la próxima.
Oops, let's move on past this. Okay. So that video was done by two of our navigators, and I think they did really capture a day in the life of a navigator. So I think that gives a good recap on really what the navigators are going through in their daily calls. And I know this slide was covered in the video, so I wanted to just take some more time to speak on this. So why call us? We can provide as navigators information on starting as early as an 18-month-old who maybe is in need of some evaluations or testing. Potentially they were screening high on their MCHAT. So this is definitely the time that navigators would love to provide information and help guide families through that process. We do receive questions around special education a lot. Another majority of our calls are frequently from looking for accessing therapies, whether it's speech or OT or ABA. We do field a lot of those incoming calls. Family supports is another big one. So supporting the family, maybe some support groups or even respite care resources are definitely another frequent call that we get. Insurance coverage, oftentimes there's a lot of questions around navigating their insurance policies or deductibles. And then we do have other resources either available to navigators or on our website as well for community events, community education. We do have trainings we provide as well on our website. Again, our employment program, which is called Upbound. And then we do assist systematically with advocacy and supports in different coalitions that we're in. And then we do have a lot of programs under our safety website, which we have historically provided a lot of first responder trainings for around autism safety. And then we do have a scholarship GPS program that I will touch on later on as well. So this is kind of the gamut of what we can help families with and pretty much anything in between. So with that, I want to be just transparent on what navigators can help with. So again, when they receive a call from a family, they ideally are sharing information and linking families to resources and programs that they are looking for. So they will, again, narrow down the search based off of the 3 criteria of the age of the individual, the insurance coverage, and their city. And then, you know, if they are looking at a pool of maybe 200 resources around them, navigators will narrow it down to typically about 3 to 4 to send to the family. So that will definitely lessen the family's time on seeking this on their own independently. So providing them with relevant information, providing guidance on barriers to accessing services. So we have seen a lot as navigators that families aren't necessarily always, people don't typically take the time to explain to a family how to navigate the programs or services or even their insurance coverage in general. So we know, especially for providers, that Blue Cross Blue Shield's track for an evaluation is much different than a Medicaid track. So navigators always take the time to help answer the questions that families have, really help inform them on the process, what to expect, what's expected of them as they go through this process, and really help guide them through this journey with them. So we will help break down goals into specific steps as well. So we often do hear, you know, families who are so overwhelmed they don't know where to start. And that is very common, and it's an okay feeling to have, but the navigators are so crucial in that moment because they can really help, you know, working through this with families on assessing what the primary goal is, or what's the end goal, what's the primary need. So breaking down, you know, what's step 1 that we want to accomplish. If that's getting into an AAEC, let's tackle that first and then work through the rest of the steps. So that really the navigators are following through these processes with this family. So it can be years of supporting behind the scenes as a navigator to help families, inform them of the process and, you know, helping answer questions along the way or providing information. So we also can consult with your support team if needed. An example of that is typically if a parent's calling wanting some resources for their adult son who's 20 but he's in the room with me or with the caller, I'm going to ask to have him on the phone with you so that we can really together have a conversation on what this individual is seeking and what type of supports or services or programs he might be needing. So we definitely like to, you know, not only support the caller but also the individual as well. Provide free program and trainings and workshops. We offer a variety of trainings. Most of them are pre-recorded and posted on our website. At the end, we have a slide that shows our website, and just under the trainings tab, you will see a variety of trainings ranging from 20 minutes on picky eating all the way up to a 3-hour early developmental stages training. So there's pretty much anything that you might be looking for support on. If it's not already pre-recorded on our website, please reach out to us as navigators, because we can always share resources of other webinars coming up as well. And then our end goal is to empower parents, and callers and individuals. So with us sharing information, ultimately, we are hoping to empower families through this journey, so that you feel equipped to, take that next step to really pursue these services and programs, and feel that you have the information that you need to navigate this as well. So the navigators are always there as a support, but ultimately, we are hoping that you feel equipped and empowered through this as well. So with that being said, I did want to highlight too on what, some of our boundaries are, what we can't do or don't have the capacity to do. So unfortunately, we can't call and schedule appointments on your behalf. We cannot guarantee that each resource will be the perfect fit for you. So with our database and services that we have, as I said, we will definitely narrow down the pool from a couple hundred options of speech therapy in your county down to maybe 3 or 4 that are, that we would suggest as close options to your home that seem to fit well with what your family is needing. We can't guarantee it's the perfect fit. So of course, we invite you as the family to really take that then to kind of interview, assess, get to know the resources that were shared, and ultimately make that autonomous choice on what you think is going to be the right choice for your family. So, everyone's unique and everyone has unique needs. So really being able to be able to find that perfect fit, it is typically on the individual. And it may even take some time to kind of feel out a couple options first before you make that choice. And that is okay. And parents always do have the choice to change their providers, even if they're starting services. Don't feel like once you're in the program, you have to stay there. So providing direct assessment and treatment plans, we don't have the capacity to do that. We're typically just over the phone or in email, so we're not able to do clinical assessments. We can't attend in-person meetings. As much as we wish we could sit with you at an IEP and help be in your corner, we just don't have the capacity to do so. We are a statewide nonprofit, so we just aren't able to provide that support in that level and capacity. There are other programs out there that we are always happy to refer you to if that's what you're seeking. But with that being said, just unfortunately, that's out of our scope. And also we aren't able to provide direct supports coordination. We're not a fee-for-service. We aren't paneled with insurance. So we don't have that type of support that we can offer families. We always are, encouraging families to connect to their supports coordinator or case managers, or if they need help or guidance on how to get connected with them, that's where the navigators will help walk you through those steps. So, it really does take a village to work and support families. And so with that, we're always helping, connect families to the programs or children to the programs that they need, or adults as well. And so, the need for a supports coordinator is so crucial. It's, we just are willing to work alongside them, but typically that's just not something that we can provide directly. So you may be thinking, if you're working with families or individuals, of, thinking of somebody who may benefit from this program, when would be the right time to refer them to us? I will obnoxiously say in big capital letters, as early as possible. And the reason for this is because we found through so many calls that we have fielded are parents who were, called their insurance company and got an option of, like I said, a couple hundred resources to weed through, or even tens of pages to contact. By the time they call us, they're exhausted. They've spent weeks, they've spent months trying to navigate this journey on their own. And I can't tell you how many times when I was a navigator, a family just, a sigh of relief would say, I wish I called you first. So I got chills just saying that, because, it is the type of relief that a navigator can provide for a family as they're going through such a stressful time as well, trying to support their child. And I don't want to emphasize that this is only for children, because individuals, on the spectrum, autistic adults too, can call us and still feel like they've gotten so many doors shut in their face that they still are looking for help and support. That really that the navigator can take kind of that relief and stress off of the family, that, the navigator will say, let me take it from here and sharing some resources for you, things that are relevant that your insurance will cover, and that from there just already expedites the process, speeds up the services getting connected to the individual. And so it really is getting interventions in quicker and earlier, and really providing care and support for these individuals who are seeking it much sooner than if the family had never called us. So another reason too why it is so important for to get connected as early as possible is if they're early in this journey, typically they do have a lot of questions, and just kind of discussing through some of those questions and supports. But what's great is that if the family is on a wait list for an AAEC, or through their CMH screening, they know that they have a navigator to phone if they have any questions through that process. So it is typically kind of a behind the scenes support. As a navigator, we aren't directly involved in person, but we're always available by phone or email. So as they go through this process, that navigator can always be a resource to them as well. So I also want to share if there are providers in here, clinicians, physicians, psychologists, or social workers. I wanted to explain our clinician portal. So this is a great way to refer families directly to us. So this would be in an instance where if you are working with a family who seems maybe overwhelmed, or is pretty busy, or just has their hands full with multiple children and schedules and coordinating all of this, and like if you gave them the navigator phone number, of course their intentions to call, but are they really going to be able to make the time to do that? So this would be a foolproof way to know that a navigator is going to get connected to this family that you're referring. So filling out the clinician portal form, and I'm going to click it here, and it's going to, I got it open right here. Okay, so this is the website. So this is on our main page. Under what we do, clinician portal is just the third drop down. And then there is just some clinical information in here, but we do have our referral form. So as the referring clinician, you would fill out this form. It is always asking for the child's demographic information, their date of birth, their insurance coverage, just specify Medicaid private, the parents' information. So we are assuming that you have the family's consent, or you are completing this form even with the family in clinic, ideally. Go through this. The next page asks for you as the referrer, your information to follow up with, so that we can always share that a family has been connected, so that closing the loop that the family is working with a navigator. And then a reason why that you're referring this family. So if it is you're at a well child visit and the child did score high on an MCHAT, this would be a good time to just fill out this form so that the navigators can provide information and resources on where to go for an autism evaluation for their child. So this is the navigator reaching out to the family directly versus the family calling in. So that again is a foolproof way. Once you submit the form, it goes straight to a navigator. They will contact the family. I do want to mention too, they make 3 attempts for initial contacts. So that typically looks like a phone call, a voicemail, and email. So they'll make 3 attempts. If they have not received contact back from the family, typically the navigators do close the case, but all it takes is just a simple click to reopen the case when the family calls back in. So there is a set number for attempts that navigators do make the initial outreach for the phone calls. So now we'll go into our case studies, and these were actually 2 cases of mine before I transitioned into the role I'm in now. So when I was a navigator, and I think these highlighted some some complex cases that weren't, as the video had mentioned, just a simple open shut case. So, it starts with one thing and then it definitely continues to grow into supporting the individual as they have more support needs as well. So for case study number 1, we have an immigrant mother who needed help with insurance and accessing services for her son. He already had an autism diagnosis. He was about 12 at the time. And I remember this phone call. It was actually a wraparound facilitator was on the line as well. So mom was referred through a wraparound facilitator who together called me as a navigator back in January of 2020. And we, had our initial phone call. I gathered the information that I needed. I was, it takes some questions and time to really figure out what the initial concern is and how to just gather more information on where they're at in the process and what maybe programs they're connected to or what they're seeking. So the navigator myself, I worked alongside the wraparound facilitator to assess the primary needs and create short and long-term goals. So this took a lot of support of us collaborating, the navigator and the wraparound facilitator with the family. This mom did have good spoken English. I will say that her written English was not as strong. So with knowing that, we didn't feel the need to get an interpreter involved. Mom understood what we were conversing about, but at times there was some support needed with written. So the navigation support came into play. I helped her fill out her Medicaid application because some of the questions she wasn't quite sure on. So I remember filling that out with her. And the reason we filled this out was because she actually was pursuing a divorce at the time, and paying for co-pays was a barrier for this child to receive services. So obviously, knowing mom didn't have an income, she and her son qualified for Medicaid. So I helped mom with her completing that application. And then from there, once she was awarded the insurance coverage and her son as well, then I referred her to her local community mental health. So knowing that she has Medicaid, then the next step was to go through the access department. And so at that time, Access had also said, well, the diagnostic report looks like it's over 3 years old, so we're going to need a current report. So at that point, myself as a navigator, I shared options of where her son can go for a reevaluation, just going through the ADOS testing again. And this was due to having dual insurance, so private insurance had to cover this portion. So that probably working through these first 3 steps, we're probably about 6 months into supporting this case. And, he's still at about the evaluation testing part of this process. So knowing that was going to take some time, and again, with income being a concern for the family, I encouraged her to also apply for Social Security for her son. And this was back in COVID, so they still were doing their phone line appointments and screenings for Social Security. So connected her to that phone number. She had that appointment, went through that process and got that ball rolling, because we know that can take several months as well. So from there, we're probably at about 8 to 10 months supporting this family. And so at that point, her CMH was, had gotten her through the intake. She had, a supports coordinator assigned to her son, but still hadn't gotten connected to ABA, which was her ultimate end goal. So I wanted to just share with her, assuming obviously there are wait times in significant areas of the state. So I wanted to just kind of front load her and inform her on her options of what ABA services or programs were contracted with her CMH, so that she was informed and ready to make that choice once that next step was ready for her. So I provided some options for who was contracted with her local CMH for ABA. And then there was other supports and resources as needed. So again, with unfortunately going through this divorce, she was seeking housing for herself and her son. So as navigators, we will provide and link families to housing agencies or commissions that help families, whether it is with different subsidized housing or just supports in general. So that was another resource that I had shared. And through this, I will say, I really just only hear from her now every once in a blue moon, and it's a random text or a phone call just saying, hey, Karah, I'm just checking in, we're doing good. So typically as a social worker, I'm always, no news is good news, but also just keeping tabs on her and knowing where her son is and how he's doing, and how they've gone through this process. And she has said so many times to me, just thanked me immensely, said that there's no way that she could have gone through this on her own, and that it was very difficult, especially too that with COVID as well. So navigating the systems of not only special education, but just Medicaid and accessing therapies, it's not easy. And we definitely know that. So this was a case that you think started kind of in one spot. And then as we worked through it, we had to get through more steps to help get them to their end goal. So ultimately, this was probably a 1.5-year case that I had worked on with her, consulted with our specialists too in different areas of need. I know our insurance specialist was supporting me as well through this case. So this was a case I just wanted to highlight of the complexity and definitely the timeline of how long this can take for a family. And imagining too, if she didn't have a navigator, where she would be at in this journey or what steps she'd still be on. So case study 2. So this is a single mother in her 60s, contacted my navigator back in November of 2018. So I believe this was one of my first cases as a navigator. I do remember supporting her over 3 years now, or about 3 years now. I remember this phone call. And so she has 2 adult sons on the autism spectrum. They both fall on different parts of the spectrum. So mom is the legal guardian of one, and the other one is his own guardian. And in speaking with mom, I had to obtain consent from her son, who was his own guardian, to be able to discuss any questions or concerns that she had in detail around her son or his case or care. So we obtained a written consent from her son. I'll call him son A. So he was his own guardian. And then son B is the one who mom is guardian over. And so just to set some context to, the family was already connected to MDHHS and their local CMH. So they were already in the system, knew of the programs and services that they were eligible for her sons, but yet she still had questions and still had some support needs as well. So in hearing son A, she had shared that he was at a local community college. He was working towards and pretty close to completing his degree. And his goal after college was to gain employment. So I initially referred him, son A, to our employment program. So to support him through, finding gainful employment and any job support needs that he may need. So he still is working with our Upbound team, and actually almost happy to report he has gotten his first offer. But I don't want to jinx that though, because I heard that in an email, but I want to make sure he took it. So with that, mom actually had called. Her first question was around wanting to review the special needs trust and financial planning that she had in place. So she had written or, had a trust written several years ago by an attorney. So she was just wanting to make sure that that was up to date and reviewed and still current. So that was her primary concern and call or ask when she had called us. And obviously being a single mother in her 60s, that was a concern of hers. So with that, I shared resources and different options close to her, even some farther away, some different programs, so that she was aware of what's out there. And I also thought she would be a good candidate for the Wayne State grant program called My Ocean. And that is for caregiving parents who still have their child with a disability living in their home, but the parents are aging caregivers. And it almost is like a support person or a case manager for the parent. So being a sibling, I'm a huge proponent on supporting families and parents through this system. So I definitely saw her as a good fit for this program. She did complete the 1 year of that grant to help get her some more support as well to address her financial planning. Also, I had referred son A to Social Security, helping, encourage him to apply for SSI because with his employment and his career path, he saw himself more so being a freelance worker, not necessarily having a consistent 9 to 5. So with that being said, and also his end goal of, living independently one day, I really encouraged him to at least apply to Social Security so that he could have that reassurance and income support if needed. And with that being that he was around 30 when I started working with him, he didn't have a current diagnostic report or anything really that had shown being on the autism spectrum. So at that point, I definitely wanted to make sure he had a strong case in applying to SSI. So I recommended that he have a current neuropsychological evaluation done so that he could provide a report and supplement that with his application. So that is the level of support that I gave this family. And as needed, mom would always call me with questions, whether it was around adult home help for her son or CLS, or, just having questions around the providers and, even during COVID, what's protocol and what's not. So there were quite a few things I didn't capture in this slide of support that I provided mom through this time. And she now, from 2018 till now, probably I hear from her every 6 months, just checking in with a quick question typically. And again, a lot of thanks too for the support that our Navigator program has given her and her family. So I hope those case studies show the level of supports that Navigators do. And ultimately, being a Navigator for life, we really do build trust with these families. We build relationships. We, learn, some pretty personal things about these families, and not being able to be there in person with them, we can still build a significant relationship and support and help guide them through their barriers and their concerns and sometimes pretty significant life experiences. So those were the case studies I wanted to discuss. And so this is a visual that I had just thought of an ecosystem. So we have the individual or the caller in the center. So that is the person contacting the Navigator. And looking outside, that is their family, so their microsystem. That might be they're calling about their child with autism, or who lives in, their family could be just someone who lives in their household. So that is their microsystem. And then looking beyond that are the services that they are connected to. So the education system, maybe MDHHS or CMH, private providers. I didn't include insurance in here, but insurance definitely should be listed in here. And MRS, if that's a program they're also connected with. So those are the types of, systems and supports this individual caller is working with and working through. And on the outside of that, the last layer is us at the Autism Alliance, where we aim to fill the gaps of, and help link families to their systems and their services, and provide information too on how to navigate this and why it's so important, and the benefits. So the Navigator program, really I see this being kind of just a holistic hug around the whole ecosystem. So if this visual helps kind of connect where we come into play, we are a alliance, so we do partner with providers, and we do have a representation in a lot of coalitions and different systems that we work with, but we also kind of are a neutral party because we aren't working necessarily in these systems directly. So again, that's why I see us outside of the third layer. So hopefully that context helped. Okay, and then what else do we do? Our Upbound program. So this again is our employment program. This started about 5 years ago, and this was from the data that over 90% of individuals on the spectrum are either unemployed or underemployed. So that staggering data had really sparked the employment program. So they provide assistance to job seekers, helping them identify gainful employment, and career paths that they are eligible for, but typically have not been able to access because there have been so many barriers through the interview process or just getting them connected to the right employer. So that is a program that is our third pillar, and it also does help train the employers on the benefits of hiring somebody who is neurodiverse. So this is a pretty unique program in the sense that we have partnerships with employers and job seekers as well. So we also, if you may have known, last year at our gala, we launched our moonshot goal of hiring 101,000 individuals on the spectrum into the workforce in the next 10 years. And that is a very ambitious goal. And we see it as a call to action as all staffing agencies to help collaborate and work together in helping us reach this goal. So this is another big initiative that the Autism Alliance is leading. We have My PAC, which is the Michigan Parent Advocate and Attorney Coalition, and this falls under our education pillar. We also have our special education coalition as well, but My PAC was really something that was born last year through COVID. It was really finding a way to support families and advocates who really wanted to make systematic changes in this education system. So they're driven by accessing equitable opportunities, educational benefits, and systematic change. And right now, the current agenda items are to address obtaining federal and state dollars to help support special education, and also addressing education and retention loss due to COVID. So if this is something that seems interesting to you or you would like to become a member of, we are still building capacity in this coalition. So you are welcome to find out more information and sign up on the website here, MIPAC, MIPAAC.org. We have our neighborhood directory. So as I referenced, Navigators have over 1,500 resources available at our fingertips. And we have this past year spent a lot of time into converting this into a public platform. So on our website, you may see a tab called Neighborhood Directory. It is available to you to search individually and independently any services or programs that you might be seeking. So you can specify and kind of narrow down your search, and it is statewide as well. So this is a great tool to use not only for families or individuals receiving services, but also for providers as well, if you are supporting families and maybe looking for, we have everything from summer camps, recreational programs, to different training opportunities coming up on our community calendar. So there's quite a bit of information in there. Our GPS program. So this is our scholarship program with Angel Sense. It's a GPS device that it's pretty small. It can get clipped and locked into like a pocket or on a shoe, and someplace maybe non-obtrusive to the user, but it can also sync to a parent's phone so they know where their child's at all times. And we do know that risk of elopement and wandering is a significant safety concern for individuals on the spectrum, and unfortunately have ended in tragedies. So this is a program that is pretty dear to our heart as well, that we welcome families to apply to on our website. And we will cover the first year cost of the device. We have our provider meetings. So again, being that we're an alliance, not only do we work with families and individuals, we also do help support providers. So they are now virtual. I believe it's every 7 weeks. We have our provider meetings, and it's a great way for providers to learn from each other's successes and challenges. We are always reporting out statewide updates or changes, either with policies or insurance coverages. I know our insurance specialist is frequently talking about different billing codes that might be changing, just to kind of, inform the providers of what might be coming down the line, or, learning from each other as well as they, as they go through some changes as well. So this does not have a fee. Again, this is something that we provide to providers. If you're interested in joining it, you may email my colleague. I have that on the bottom of the slide here. Her email address, Shanta Sagai at AAoMI.org. And she would be happy to add you to our mail list for the provider meetings. And then lastly here, I know I'd mentioned we have trainings, so we do provide a variety of trainings and programs. Typically they're grant funded for different initiatives, but we do have a lot of pre-recorded trainings uploaded on our website. And we do have our annual Navigating Autism Today conference in the spring. So we're gearing up and excited to roll out our spring conference for 2022. So more to come on that. If you haven't already, please like us on Facebook. We are pretty active on our Facebook and social media pages, and always keeping everyone up to date on where we are at with our upcoming programs and events. So last slide before we get to Q&A, sorry about that. Okay, so this is how to reach us. So a Navigator, this is their email. So it's navigator@AAoMI.org, or you can call them again, Monday through Friday from 8 to 6 at 877-463-AAoM, which is actually 2266. That's the last 4 digits. And then our website as well has, the clinical portal, a way to contact a navigator through that, our main webpage as well, and a lot of information. So I definitely welcome you to check out our website at AAoMI.org. Okay, and now this is the end of the content. So I'm happy and welcome to take any questions now.
Okay, thank you, Karah. That was wonderful. We have had quite a few questions submitted over the chat, so I'll just start. And I think that you may have answered some of them throughout the presentation, but I'm just going to ask them anyway to make sure that we get everything covered. So the first one is asking if the focus is on school-age children or if there are programs for older adults who are navigating the adult service sector. And I do believe you answered that, but if you want to add anything at this point.
Sure, yeah, so we definitely do support the entire lifespan. So we have, whatever it is you are seeking, whether it's, mental health and counseling supports to, independent living, we can provide information for adults as well. So we do have a specialist who helps with community resources too. So this definitely, I hope I didn't give the impression that this was very pediatric or young age specific. We do support the whole lifespan.
Excellent. The next question is if you would provide help or services for someone who is 16 who has fallen through the gaps.
I would love to learn more information on that, so that, seeing what gaps necessarily they've fallen through. But we do have, our navigators would be happy to, I would definitely just recommend calling our navigators to really have them, assess more, gather some more information and see what it is you may be needing support with.
Excellent, thank you. All right, the next one is, can you assist a family in getting a letter from their insurance provider stating whether or not they cover autism services and how much of the cost they cover?
Yeah, so typically that can either be on your summary of benefits or, you can, the insurance company does have to provide their policy on what they cover. So whether it's through your employer and HR providing the benefit report, our insurance specialist can help review it with you and really kind of, I know the reports are very long. So, she is able to kind of focus in on the autism services and if they are covered on a said insurance policy.
Excellent, thank you. Our next question is, can you or how do you assist with school advocacy when parents are working through the IEP/504 plan process?
Yeah, so we have a special education guide for parents. So we have a written report. We have, again, navigators can help answer questions or provide guidance on working through the process. So whether it's putting things in writing, we definitely recommend in the school system, Or two, if it's something that you are needing more direct support with, or maybe an advocate to help assist guide you through the process, we're always happy to refer to other programs too who are very education specific.
Excellent. That is the last question. And so I will remind everyone, if anyone does have a question, please feel free to type it in the chat. And while we just wait a moment, I will let everyone know that a copy of today's presentation in PDF form and a link to the recording of today's presentation will be sent to all participants within, I think Zoom sends it out about 24 hours after we end, so probably tomorrow afternoon. I don't see any other questions being submitted. There are some really positive comments. People think these programs are fabulous. So thank you very much. We really appreciate you for sharing all of this information today. Is there anything you would like to say to end today's presentation?
Just other than thanking everyone for listening today. This is an honor to support everyone touched by autism across the state. So I'm glad everyone was able to gain the information today, and hopefully this helped you in learning more about our programs at the Autism Alliance and how we hopefully can help connect you to programs and resources.
Wonderful. Okay, well, thank you again for your time and all of your knowledge, and thank everyone for participating, and we will hopefully see you next month.
Thanks, Marie.
Thank you.